Now we're moving on to part C, lymph node palpation. Ms. Roselle is going to compress all the lymph nodes with fingertips using moderate to deep pressure against underlying tissue in a circular motion. She's going to instruct me to tilt my head forward and attain full view of the neck region. She'll be bilaterally palpating the occipital nodes, beginning at the midline of the neck, moving anterior laterally to the sternocleidomastoid muscle. She will cover slightly above and slightly below the hairline.
Kelly, can I have you tilt your chin down for me? I'm just going to be feeling around here. And so what I'm going to do, thank you, that is very helpful. So moderate to deep, she should be able to feel it, and moving towards sternocleidomastoid and then above the hairline. Okay.
Now she's going to displace the ear forward and visually examine the back of the ear and skin behind the ear. She'll palpate the post-auricular nodes located posterior to the ear with the opposite hand. Now she's going to palpate the pre-auricular nodes beginning anterior to the ear and moving downward to the angle of the mandible. Now she's going to bidigitally palpate the submental nodes by placing the hand at the midline of the mandible and compressing with the index finger. Using her left hand to slide tissue towards the right, she will cup fingers under the chin and roll tissue up and over the border of the mandible, keeping her fingers in position, and allow the tissue to slide over the mandible into normal position while palpating the submandibular nodes. She'll repeat this same thing on the left side.
Hold here, and I'll push.
Now she's going to instruct the patient to tilt their chin down and to the side and rest the patient's chin in the palm of her left hand. She'll palpate the cervical nodes medial to the muscle, using the right hand to rotate the fingertips back and forth along the sternocleidomastoid muscle from the posterior ear to the clavicle.
Okay, so I'm going to have you turn your head kind of into my, there we go, perfect. So this is the muscle you're looking for. She has a very defined one, so this will be easy. So first you're going to roll your fingers over like that, all the way down. And then as you're coming to the post-cervical, you're going to go up like that. And now I'm going to have you turn to the other side. Thank you, that's perfect. And I'm going to roll over. Thank you.
Now she's going to reposition fingertips under the sternocleidomastoid muscle to palpate the cervical nodes posterior to the muscle from the clavicle, posterior to the ear. She's going to repeat the palpation of the cervical nodes on the left side.
So I just did them at the same time. I'm really sorry I got ahead of her, but
that's okay. So yeah, she
we
did
just
both.
did that.
Instruct the patient to face forward and tilt chin slightly downward to bilaterally palpate the supraclavicular nodes.
Okay, now Kelly, for these I'm going to be going right next to your collar. Are you okay if I move your collar just a little bit just to see on top of your clavicle? Thank you. I always like to let my patient know what I'm doing for this part, because it's not every day that a dental hygienist or any medical professional is touching by your clavicle. So, okay.
Now she's going to document and refer any non-tender, fixed, enlarged, or matted nodes for secondary evaluation.
And she didn't have any of those, so we're okay to continue. Everything's within normal limits so far.
Moving on to part D, salivary and thyroid gland. She's going to place palms of the hand in the anterior ear area with fingers extending to full length of the cheek and bilaterally palpate the parotid glands using circular compressions.
So you want your hands like this, and I'm going to circle. Okay.
She's going to instruct the patient to touch the tongue to the roof of their mouth. Locate the notch in the inferior border of the mandible by placing the fingertips at the angle of the mandible and moving anteriorly until she feels a shallow depression. She'll move her fingertips under the jaw and bilaterally compress the submandibular glands upward.
Kelly, can I have you put your tongue to the roof of the mouth? I feel for the angle. I'll move till I feel that notch, and I'm going to push up. Okay.
Okay, now she's going to ask the patient to swallow, and she's going to visually examine the thyroid gland. This helps if you come from the back of the patient and now you're standing in front of the patient, because otherwise when they swallow
you can't see where the thyroid is.
It won't help you at all.
Okay. Did you finish reading that part?
Just
Sorry.
that portion.
Okay. So Kelly, can I please have you swallow? Okay.
Now she's going to, now that she's located where the thyroid gland is by swallowing, she's going to ask the patient to tilt her head slightly to the right, use the left hand to gently displace the trachea to the right, and place the right hand between the Adam's apple and the sternocleidomastoid muscle. She's going to place her hands stationary and ask the patient to swallow, and then she'll repeat this on the left side.
Okay, Kelly, maybe tilt your head a little bit towards me. So I'm going to find right where I sat. I'm going to push this way just a little bit, and now I'm going to have you swallow. Good. And now I'm going to have you turn your head to the left. I'm going to do the same thing, and I'm going to have you swallow. Good. Thank you.
Now she's going to note and refer any pain or enlargement that I may have reported to her or that she may have found for secondary evaluation.
Did anything feel uncomfortable or hurt at all while I was doing that?
Nope, everything was great.
Great.
Thank
Same
you.
with me.
Moving on to part E, temporomandibular joint, or TMJ, and the muscles of mastication. She's going to bilaterally palpate the temporalis muscle with a deep rotary motion.
This is the good stuff right here, guys.
Oh yeah.
So the temporalis, if you remember from anatomy, goes all the way around. And then I kind of like to do one level higher too, just to make sure I get everywhere. And of course, to give her a great massage.
Oh yeah.
Okay.
Now she's going to bilaterally palpate the masseter muscle with the patient's mandible in a relaxed position, and then she's going to repeat the palpation of the masseter with the teeth clenched together.
Okay. So Kelly, I'm just going to have you relax. Now I'm going to have you clench your teeth together, bite. Good. Oh wow. Got great masseter muscle.
Oh yeah. All the better to chew my food and grind my teeth. Now she's going to ask the patient to report any clicking, popping, cracking noises, or pain as you palpate that joint.
Okay. So I'm going to find the TMJ. Go ahead and open. So that I'm going to locate it. Good. Open and close. Good.
I
Okay.
feel a little bit of cracking.
I feel that too. Is there any pain when you do that?
No.
No? Are you wearing a night guard at all for it?
No.
Okay.
I should.
Okay.
I don't.
All right. And then, sorry, I got a little bit ahead of you there.
Now you're going to locate the TMJ by placing the fingers anterior to the ears and ask the patient to open and close slowly.
Okay, so we did that. So you'll
Yep.
locate it, open, and now close.
And now
No, you're okay.
while facing the patient, bilaterally palpate the joint as you have the patient open and close several times.
Okay, so now I'm going to have you open and close, and now open and close. Okay, I'm still feeling that kind of clicking, that crepitus.
Yep. And also when she holds still, she can feel even more. Sometimes it's easy to stay in a moving motion, but you move at first to see if there's anything that may have slid out of place. And then if you noticed, as she was still palpating the TMJ joint, she held still so that she could feel if there was anything that moved. Now she's going to have me she will palpate the joint as she has me move my mandible laterally from side to side while she stands in front of me.
Okay, Kelly, I'm going to have you open again, and now I'm going to have you move your jaw right to left. Good, side to side one more time, Good, thank you.
And now she's going to palpate the joint as the patient protrudes the mandible.
Okay, so I'm going to have you, yep. I always say, just stick your chin out towards me. Good.
Like a bulldog.
Yep, awesome.
Okay. Now she's going to bilaterally palpate the maxillary sinus.
Okay, I'm just going to feel your sinus here. Anything feel tender? Did you feel any pressure?
I didn't.
Okay.
And that's what's important to ask too, because if you're just palpating the maxillary sinus, it tells you nothing. But what you're asking for is a response from the patient. Did you feel anything? Extra pressure? And the answer should be no. But if it's not, she will document and refer any lateral deviation, crepitus, clicking, popping, or pain for secondary evaluation at this time.
And I would go write in the extraoral box on your yellow sheet, I would write that I felt crepitus when she was opening and closing. The patient did not experience any pain upon it. And then I also like to write if they have a night guard or not. That's a lot of the reasons why we're feeling for that too. So.
And if it was bilateral and how long
yes.
it's been going on.
Yes.
Now for medical legal records, says part C, but it lies. It's part F. She's going to change your gloves prior to proceeding to the intraoral examination. Very important.
Yep.
And she's going to document significant information on the treatment record, including abnormal or unusual findings, asymmetry, morphology, surface texture, consistency, size, color, and any patient-reported symptoms. That's the end.
You did
Thanks.
it.
Goodbye.